Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and joining us in studio right now is Dr. Josiah Fitzsimmons from Vero Health Center. A little different name because you're doing more than what we normally talk about,
Absolutely.
Dr. J.
Today we're talking about knee issues, which affect so many millions of Americans on a daily basis.
Now, what kind of issues are you talking about?
Absolutely. So people on a regular basis affected with knee issues are going to have difficulty walking around, difficulty with activity, pain, tenderness, maybe swelling in your knees. Maybe you wake up in the morning and your knees ache. You try and go for a walk or do basic activities and it's painful. You have to sit down on a regular basis. You're the person, that you got to always park close to the grocery store because you can't walk very far, or you got to get dropped off,
right,
at the site because it's difficult to walk longer periods of time because you got all that pain.
Because you have painful knee, yeah.
Exactly. And so once you start having pain in your knees, then oftentimes you're very less active. Therefore, people with issues in their knees, then they start having lots of weight gain because they're not as active, right? Then they maybe start limping or moving in different areas, and you start having hip issues or ankle issues, and it can really start to affect your entire body.
Yeah, so one thing just leads to another, doesn't it?
Exactly.
Okay, but there are some things we can do about this, right?
Absolutely. So that's really what our whole entire knee protocol is designed in our office, to actually get to the source of your knee issues, correct it at its source, improve that spacing in your knee with all of our regenerative protocols, all of our medical equipment, all of our doctors. We're going to have a full knee recipe to try and help you avoid surgery, get out of pain, live the life that you want to do without having to have your knee cut open.
So what are some of the conditions that fall into place here that you can help with?
Absolutely. So someone has tendonitis, osteoarthritis, Baker's cysts, any types of dislocated kneecaps, torn ligaments, torn meniscus, your knee has just deteriorated. Maybe your doctor's told you, it's almost bone on bone. Maybe you've had some sports injuries in the past, or just excessive wear and tear. Maybe you're, in a very physical, demanding job over many, many years, or maybe you played a lot of sports growing up, and that just caused your knees to start to wear out. And then very similar, like a car gets out of alignment over many years, just gets worse and worse and worse, right? You can go get new tires very easily, but you don't want to have to get new tires, get new knees, okay? Because that's a much more invasive surgery and can have lots of complications.
Now, I think we know the answer to this next question, but how do you know if you have some of these conditions? Because I think a word that starts with the letter P comes into mind, as in pain.
Yeah, absolutely. Pain is a big indicator of something deeper that might be going on. Actually, only 20% of your nerves in your body are actually sensory or pain feeling. So you could have a lot bigger issues and not even know about it. If you already have pain, it's definitely been there for an extended period of time. But what you want to do is come into our clinic so we can do a full knee evaluation, figure out exactly what's going on, figure out the level of deterioration, come up with a comprehensive, extensive game plan to get your knee issues corrected for good, and not just continually mask them with drugs.
I was going to say,
have to get surgeries.
People mask them with, you see all these creams and these ointments that are advertised. Talk a little bit about those.
Absolutely. So creams, pills, these things can do a lot to give some temporary relief, but that's really all it is. They're just going to wear off. You're going to have to try them again, take more pain medications. We all know the dangerous side effects of medication, especially opioid drugs, in the opioid pandemic in the country. And so we really want to avoid people just masking their symptoms, just trying to push it off. So many people just say, I just got to live in pain, and then maybe when I get older, I'll do a knee surgery. Don't sacrifice the quality of your life. Let's do something about it.
Yeah, you talked about knee surgery. We were talking a little off the air. That's not a pretty thing.
No. That was my original plan, was to be an orthopedic surgeon, and I saw firsthand, in observation of those surgeries, how they literally, use essentially a sawzall to cut off the bottom of your femur, the top of your tibia, and put a new knee right in there. It's a very dangerous, and complicated procedure that could really have lots of complications.
But you can avoid that. That's the most important message you want to get across here too.
Absolutely. If you're looking to get out of pain, avoid knee surgery, get off your medications, give us a call.
Okay, and we have a special going on right now too. Let's talk a little bit about that. This is just for knee pain.
Absolutely. So come in off the street. Normally it's going to cost about $200 to get all the initial exams, consultations, reported findings, figure out exactly what's going on. But we have a special. If you do have knee pain, give us a call immediately. Get in as soon as possible. With knees, like I said, it's just going to get worse and worse and worse, harder and harder to do something about it. So you need to get on top of it so you can really enjoy that quality of life. There's no reason to keep living living in pain and sacrificing time with your grandkids, time with your kids, activities, traveling. So many people just resign to staying in their houses, don't doing fun activities because they feel like they're not able to.
Okay, if somebody gives you a call, how soon can they be seen?
You know, the greatest thing is we have our brand new facility, 10 doctors, 1 location.
Wow.
Give us a call. We can typically get you in within 24 to 48 hours.
All right, one more time, let's remind everybody about this special. It's $39, normally about $200 for this, and this is at 630 South 50th Street in West Des Moines. The new building, which is phenomenal. If nothing else, go over and get a tour of that. There's the number, 335-VERO, 335-VERO, VeroHealthCenter.com is also a place where you can get some more information on that, and you can book right there.
Absolutely. Biggest thing, like I said, is let's get to the cause of the problem. Let's stop covering it up with creams, with surgeries, with medications, things that are just going to give temporary relief and have long-term consequences. Let's kick it the right way from the beginning. You know, short-term, put in the work, come to our clinic. Long-term, impact the rest of your quality of your life.
Great job. Thank you, sir.
Yeah, absolutely.
Appreciate it so much. Don't go anywhere. We'll be right back. This is Iowa Live.